My name is Bulai Sidwell Lengata. My profession is a mental health coach. Basically, what the mental health coach does is that they engage with the clients and understand the challenges that the client is facing. I'm being certified to engage and deal with the issues of the mental health. Then that's when I will understand what the client is faced with. The best way to engage with the client is have one-on-one engagement. It might be online, it might be face-to-face engagement.
Your 11 o'clock is here.
Oh, okay. Now, how's it? I'm good, thanks. How is that? Because
Sometimes others, they come in and say, I don't have a problem. But then you find that once you start engaging with them and you say, okay, tell me, your scan says it's 5 out of 20. Then you say you don't have a problem. How have you slept last night? It starts now engaging, then they say, oh, I was not aware that I've got actually mental health issues. We also have our lay counselors, of which they are doing an outreach.
Hi.
Hi, how are you?
Okay, this is a self-test.
And then a lay counselor, that's when now they will start approaching them, informing them about the programs that Aurum Institute is having as a pop-in. And then that client, they go into the tent and then they get tested.
All the instructions are there inside.
We introduce the program to them. That's when now it becomes easier for them and then they are able to access.
What Coach Sidwell does with his team of coaches is bridging that gap between the biomedical prevention and treatment services to the actual psychological and social support and treatment and services that's required.
It's way, way better for you to come to the private institute whereby you know that whatever you engage, you're engaging with people who understand, who lives the same way with you, and then they will understand if you open up to them and say, I'm an MSM. Because some MSMs, they've got their wives at home.
Hi, how are you?
I'm good, thanks. Good, thanks. Take a seat.
Then now it goes back to what we call an Inuka method. That's where now I say there is a clinic there that is really going to be suitable for us, since whatever we are doing is confidential and people doesn't have to know about it.
I thought we'd just discuss a little bit around your medication.
Then they need a mental health coach to go through the journey, to assist them, to help them understand and try to come up with a solution.
It's like I tend to forget.
My role is not to tell you what to do, but then as a mental health coach is to sit down with you, is to engage with you. So imagine if no mental health coaches that are there to engage with them and make them to understand that there is a life after that.
Keep well, we'll see you at your next appointment.
When we dispense the medication, then you have a chance to interact with the participant one-on-one, find out what are their concerns about the medication, what are the barriers to taking it properly, what works well, and then we can sort of come up with a little plan that they can use moving forward to make sure that they take their medication regularly.
If you deal with the mental health, if the client needs to be diagnosed with depression, there's nothing wrong, because we've seen that as much as HIV has got stigma, also mental health as well has got stigma. But with this intervention, we are able to encourage clients to come out, those who've got mental issues, and see that interventions are there for them.
Making use of the Inuka method. Number one, what is important is to build a rapport with the client. Then the client becomes comfortable, is able to open up and relax. Aurum, Inuka method, I think they bind together.
From the Inuka method, you learn how to identify.
Because of that's why we realized that our MSM people, they really need the services. Being a qualified mental health coach, it gives you a platform where now you understand your client. Now I'm able to deal with issues that are more complicated than I used to in a professional way.
The people there all are driven because of the passion. They do the work because they believe in it, and they believe in making a better life for individuals within our LGBT spectrum.
You know what? I need to save these people. I need to save this community. That's where now I don't rest. I see myself fighting for justice and making sure that my community, they live happily ever after.